looking at where we are in the world right now, has the pandemic shifted focus or implementation around the National Action Plan? For instance, with more and more health systems transitioning to telehealth, a model likely to persist for at least the near term.
Yeah, I mean, the pandemic affected the plan mainly in the sense that it delayed the release because we had to think about what appropriate timing was based on, when organizations might even have the ability to put their attention on this given the crisis that was going on in March and April and May. That being said, I think the recommendations in the plan are just as relevant during pandemic or post-pandemic, hopefully we'll get to that post-pandemic phase, are just as relevant as they were before the pandemic. And I think that speaks to the fact that these are meant to be foundational things that are applicable no matter what the issue or crisis is that's happening. So, we haven't changed the plan actually because of the pandemic, because as we looked through it, it really just remains incredibly relevant. And actually, even if you think about the four components of the plan, certainly leadership has been a huge piece of the response to COVID. Certainly patient engagement and really engagement of the public has been a huge component. Workforce safety has been front and center, and actually, initially, when we made the plan, we thought there would be a lot of questions about, why does a patient safety plan have workforce safety in it? And we were kind of expecting that maybe a little pushback on that. And I would say the pandemic has only made it even more obvious that that's a really important piece of the plan that needs to be there. And lastly, the learning system has been front and center as well. I mean, if you think about the rapid learning and improvement that has needed to happen both within organizations and across organizations for COVID, it just reinforces the fact that that's a really critical piece that we need to have reliably in place. So I think, we are anticipating that people will see those connections. We'll try to help draw some of those connections as we put out the plan, and it has, I think, been very validating to the work that we've done.
Yeah, I agree completely. I think Tejal covered that well.